So this part of the assessment, I'm going to take a look at the patient's abdomen area, but to begin, I would always have them to urinate first. So to begin with, I would just kind of look over the patient's abdomen and check for the contour to make sure that it's round and it's not distended and it's not tender. Is that tender?
No.
Okay, I would always check the symmetry to make sure what's on this side is also equal to this side. I would also take a look at the umbilicus and make sure that it's central and midline. While doing this, I would also just take note of the patient's demeanor and just to see if, he is in a relaxed position and nothing toward the abdomen is bothering him. Also, I would check for any abnormal skin colors. Have you noticed any changes in your skin or your abdomen?
No.
Okay. I would also check to make sure there's no pulsation here where the aorta is, or any movement, and there's not. And I would also just take note to make sure that the hair is evenly. Now I'm going to take a listen to the patient's bowel sounds. Bowel sounds just sound like gurgles, and I'm going to listen into all 4 quadrants using the diaphragm. Normal bowel sounds are about 5 to 35 per minute. And like I said, they sound like gurgles. If there was an absence of bowel sounds, this would indicate that there's no peristalsis. I'm also going to listen for any vascular sounds. Any high-pitched noises in the abdomen would indicate a friction rub. So now I'm going to listen to the aorta, which is located in the center of the stomach here. I'm also going to listen to the renal arteries. Can you sit back a little? And then I'm going to listen to the iliac arteries down here. And as I'm listening to those, I'm just checking. I'm going to percuss the patient's stomach, and what I'm listening for is for there to be dullness over the liver area and for there to be tympany over the spleen. Just sit back. I'm checking all 4 quadrants. So now I'm going to measure the patient's liver spleen, and in order to do that, I'm going to start percussing down here at the bottom, and I'm going to hear tympany, and I'm going to keep percussing until I get to where I hear dullness, which is about right here. I'm going to mark that with a pen. Then I'm going to go start up, and I'm going to hear tympany, and I'm going to keep coming down until I hear dullness again. I'm going to put another mark there, and then I'm going to measure the width of that. The normal measurement of the liver span is 6 to 12 centimeters. So just like measuring the liver span, I'm going to do the same procedure to check for the spleen. So I'm going to start in the middle, and I'm going to percuss until I come over here and I hear dullness. Put a mark there. I would come down here and do the same until I hear dullness again. And that would be the span of my spleen. So after I've inspected, auscultated, and percussed the patient's abdomen, my last step is to palpate. I'm going to start off by just lightly palpating all 4 quadrants. And I'm checking to see if the patient experiences any kind of pain. Let me know if this hurts. I'm checking all 4 quads. And so if the patient doesn't experience any discomfort, I'll do a deeper palpation. Does this hurt?
No.
While I'm palpating, I'm also checking for any masses. And the patient doesn't have any. Now I'm going to palpate for the liver specifically. I'm going to do that by putting my left hand here. I'm going to have the patient to take a deep breath and hold it. I'm going to press up. Does that hurt?
No.
So after palpating the liver, I would come over and using the same technique, I would palpate the spleen. Take a deep breath and hold it. Does that hurt?
No.
After checking the liver and the spleen, I would move down to the kidneys. Does that hurt?
No.
Does that hurt?
No.
And the last thing that I want to palpate is the aorta. When I'm palpating the aorta, I'm making sure that there's not any abnormal pulsations. Deep breath and hold it. The last thing that I'm going to palpate is the inguinal area, and I'm just checking for any pulses or masses or any hernias. The patient doesn't have any. For this part of the assessment, I'm going to check the patient's neural status. So while I'm asking the patient these questions, I'm just kind of taking note of their demeanor and just their mental status in general. So have you been feeling okay?
Yep.
Okay. Could you tell me your full name?
Alan Hendren.
Okay. Can you tell me what city that we're in?
Richmond.
And what year is it?
2013.
So the patient seems to be alert and oriented times. For this part of the assessment, I'm going to be using the Snellen chart to test the patient's vision. I need you to cover your right eye and read the lowest line that you can possibly see.
LTFPH.
Very good. Now cover your other eye and read the smallest line that you can see.
LTFPH.
Right. You got all the letters correct. So this was 20 feet away, and you got all of them correct, which means that you have 20/20 vision in both eyes. Now I'm going to test your peripheral vision. Take this and put over your left eye. Look straight ahead at me and tell me when you see my fingers.
Now. Now. Now.
Good. Now cover the other eye, and we're going to do the same thing. Look straight ahead and tell me when you see my fingers.
Now. Now.
Now I'm going to check the patient's trigeminal nerve. I'm going to do this by having you to clench your teeth without showing your teeth. Okay, I'm just going to take notice of his facial expression to check for any atrophy. It's all symmetric. This is going to be testing the cranial nerve 7. Okay, so can you raise your eyebrows? I'm checking for symmetry on both sides of the face. Okay, now can you smile without showing your teeth? Okay, put your lips together like you're going to whistle. Okay, now smile, show me your teeth. Good job. In order to test the patient's cranial nerve 8, I would have them to stick out their tongue. And then I would take something that's sour and put it on this side and have the patient describe to me what it tastes like. And then on the other side, I could do something like chocolate or coffee and have the patient to tell me what it tastes like. Okay. So to check cranial nerve 9 and 10, I would have the patient stick their tongue out and say ah.
Ah.
Okay. I would check the uvula to make sure that it's symmetric and it moves the same. I would also give the patient, you can close it, I would give the patient a drink of water to make sure that they can swallow well, and then I would also use a tongue depressor to check the patient's gag reflex. This is cranial nerves 9 and 10. For cranial nerve 11, I'd have the patient to shrug their shoulders. I would check for symmetry. Okay. For cranial nerve 12, I would look at the tongue more specifically. Can you stick it out? Can you move it to the right? Move it to the left? Okay. This part of the test, I'm going to be testing the patient's muscle strength, but I'm also going to be taking note of the tone and the size of the muscle to make sure there's no atrophy. Okay, so can you squeeze my hands? Squeeze as hard as you can. Okay. Hold your hands like this. Okay. Keep me from pulling your hands down. Okay. Bring them down here. Keep me from pulling them up. Okay. You're going to do the same with your legs. Try to push my hand up. Okay. And again. Okay. Push my head down. Okay. So I'm just checking to make sure that there's equal strength on both sides, and there is. Okay. If I could have you stand up. This is the Romberg test. I'm going to have you put your feet together. Feet together. Okay. Now close your eyes. Look straight ahead and close your eyes. Okay. So I'm just taking notice to see if there's any swaying and to see how good the patient's balance is, and it seems to be okay. Alright, so open your eyes. Put your feet apart. Okay. Now, lift your left leg up, and I want you to keep me from pushing you over. Okay. So for this test, there may be a little unbalance, but the patient should recover quickly. Okay, I'll do the other side. Okay, so he recovers good. Alright, so you can have a seat. I want you to take your thumb and touch all of your fingers. And for this, I'm just checking for coordination, just to make sure the patient's not slow at doing it and make sure everything's coordinated. Now, can you take your heel here and can you take your right hand and take your finger and touch your nose? Okay, and do the other hand. Okay, and put your legs down off the bed. Okay, so for this next test, I'm just once again checking for coordination. Put your hands like this. Go like this. So you have symmetrical movement and do it faster. Okay. Testing the patient's sensory motor function. In order to do this, I'll do a variety of different tests. Okay, so for the first part, I'm going to test for superficial pain. I'm going to take the end of a broken tongue blade. It has a dull side and it has a sharp side, and I'm going to see if the patient can differentiate between the two. Okay, so tell me which side is touching you.
The dull side. The broken side.
Okay, and just like with that, I'm going to test the patient's ability to feel tactile discrimination. To do that, I'll use the end of a Q-tip. You can just tell me which hand I'm touching.
The left. The right.
Okay. Now I'll test the patient's ability to feel vibrations. Just tell me where it is that you're feeling the vibration.
On the right arm.
Let me know if there's a difference in the intensity of the vibration.
Left knee. On the right leg.
Okay. To test the patient's stereognosis, I would just place a coin in his hand and let him describe to me what it is that he feels and which hand that it's in.
Right hand.
Okay. To test the patient's graphesthesia, the patient needs to be literate. And to do that, I'm going to have the patient hold his hands out and let him describe to me whether I'm drawing a letter or a number. To test the patient's 2-point discrimination, I would use the ends of a paper clip, and I'm just going to have the patient to tell me whether he's feeling 2 points or 1 point.
2.
Now I'm going to test the patient's deep tendon reflexes. I'm going to start by testing the biceps. I'm going to do that by holding the patient's arm at a 45 degree angle. Okay, and I would hold it here. I would then take a reflex hammer, hit here, and the patient's arm should flex a little. I would also do the same to this side, holding it at 45 degrees as well. And after that, I could test the patient's brachial radial reflex by coming down to the forearm, holding the arm slightly at a 40-degree angle, hitting the tendon there, and there should also be a reflex. To test the patient's tricep reflex, I would do it sort of like I did the other ones, except for I would hold his arm out here. I would take the hammer and hit here, and there should be slight extension to the arm. I would also do the same with this side. To test the patient's patellar reflex, I would have him to slightly let his knees bend a little, let them hang loosely. Then I would support the back of the leg. I would take the reflex hammer and hit right under the patella. There should be slight movement. I would also do the same to the other leg. And to test the Achilles tendon, I would come down here, slightly hold and support the leg. I would take the hammer and hit in the back of the Achilles, and the leg should also move a little there. I would also do the same. In order to test the patient's abdominal reflexes, I would take the end of the hammer and I would just stroke each quadrant and see if the abdomen slightly reflexes to it, each side, and it does. Okay, see that? Okay. And for this one, I would hold the patient's leg up. I would just slightly graze the bottom of the foot, and the toes should pronate. The other side should do the same. And that shows his. For this part of the assessment, I'm going to be looking at the patient's musculoskeletal system. For each joint that I'm assessing, the whole time I'm also taking note of the skin color, the size, and just the overall appearance of the joint. And in all joints, I will be testing for tenderness and crepitus or anything that would be considered abnormal. Okay, so the first joint I'm going to test is the temporal mandible. In order to do that, I'm going to place my fingers here in front of his ears and have the patient open and close his mouth. There should be no popping, no locking, and no crepitus. It should be smooth and even, and it is. Okay, so now I'm going to take a look at the cervical spine. From the front and both the back sides, I'm checking for symmetry. Okay, can you turn your head to the other way? Okay, now can you go like this? Okay, to the other side. And the whole time I'm checking just for symmetrical movement to make sure that each thing is the same on each side. Now I'm just going to palpate the shoulder joints. You let me know if anything is tender. I'm checking for just crepitus or any abnormal masses or nodules. I'm checking all of these joints. Okay. Now I'm going to look at the elbow. The movement of the elbow should be fluid and smooth. Okay. And we'll look at the wrist and just kind of palpate it and make sure there's no hard nodules or any crepitus. Can you move your wrist? Okay. Okay, can you stand up for me? For this part of the assessment, I'm just going to look at the patient's hip joint. Okay, can you Take your leg out this way. I'm checking for abduction. Okay, and the other one. I'm also checking for adduction. Can you take your arm out like this? And back. This side. And back. Can you bend your knee? Okay. And the other one. Good. Okay. I would also take a look at the patient's foot and ankle. Can you push your foot down like you're giving it gas? Can you pull it up? Do the same. Okay. So anytime I'm palpating a joint, no matter which joint it is, I'm checking for redness, swelling, any tenderness.